Hi, I'm Felicity, a registered nurse, cosmetic injector, and founder of the Fit Injector Clinic. Welcome to my channel and video podcast streaming on YouTube, Spotify, and Apple. Today is a bonus episode, a solo episode. I think that's my first one. Well, this takes me back to my OG YouTube days, being here on my own. I'm going to do a bonus story, which is gaining a lot of attention right now in Australia for two reasons. Number one is it is unfortunately an extreme adverse event post a cosmetic procedure. Two, that the regulatory bodies and news outlets reporting on this case are using all the terminology that injectors were banned from using last year under the updated regulations. So the current story involves a situation of a non-medical professional providing unregulated, unregistered cosmetic treatments, which have led to multiple hospital admissions in the past few days. Now, it is still a developing story. It's still being investigated and people still remain in hospital. So here's an overview. So the first post that I saw 4 days ago was posted by New South Wales Health on Instagram. And the headline is "Likely Cause of Botulism Linked to Unregulated Anti-Wrinkle Injections." So at this point, there was one woman in hospital. She had received an unregulated anti-wrinkle medication at a residential premises 2 weeks prior to her hospital admission. Since this post was made 4 days ago, there has been multiple other people also admitted to hospital who were also injected at this residential premises with this unknown medication. Now, this isn't fact checked, but I have heard that apparently the dose was something like 2,000 times higher than what is the therapeutic dosing for botulinum toxin medication. Now, literally any medication given at a dose that high above what is therapeutic dosing would be extremely dangerous. That's a note, particularly for those in the news article comments saying things like, who would even inject toxin into their faces? It's poison, etc., etc. They are the same ones that are posting, big lip photos and saying that it's from this medication. Now, this medication is not a volumizer. It's not the same thing that goes in lips. So well done to the comment experts. Now, multiple news outlets are reporting this case using the words Botox and anti-wrinkle injections, neither of which medical professionals are allowed to refer to publicly, and nor was it official Botox, or these people probably wouldn't be in this situation. Unfortunately, it was an unknown product imported into Australia that is neither FDA or TGA approved. Yes, fake cosmetic injectables unfortunately exist. Now, go and get a fake handbag, go nuts. I prefer the real ones, no shade. But whatever you do, do not get fake injectables or you will literally end up in hospital. So let's talk about these new regulations and how this is potentially increasing this type of dodgy situation. There really needs to be a wake-up call for the regulators to consider what actually protects consumers when it comes to receiving cosmetic treatments. Medical professionals are unable to properly educate their patients on the treatments, products, and pricing online, which forms an integral part of consumers doing their research and being really well informed prior to a procedure. Also, not being able to see before and afters of that professional's work and their ongoing results with their patients. This then leads to consumers ending up in situations that they may not know how to say no. They may not have an understanding that it is a red flag situation and that cheap pricing means you should probably run, and potentially ending up in these residential back alleyway type situations for what is a medical procedure. And to add to that, also consumers ending up not being treated by a registered nurse, medical doctor, or a dentist, which are the only three options when it comes to these procedures in Australia. And unfortunately, some people may pose to their patients that they are a medical professional, and some patients may not know how to actually double check that. Not understanding that these medications are scheduled and require a prescription. Now, most of our overseas patients actually have no idea about this because the regulations are so different elsewhere in the world. To add to these updated regulations, it seems that only some clinics and injectors are following these changes. It doesn't seem like it's being enforced by the regulatory bodies, which I feel leads to further confusion for consumers, because they will see one clinic who's not advertising their products and their pricing and dosing and before and afters, and they'll see another clinic that's still doing exactly that, and they might think that one clinic isn't actually doing those treatments anymore. Let's talk about some other dodgy situations. I'm in quite a few nurse chat groups, and obviously I follow a lot of other injectors and clinics online, and I feel like a lot has come up since this situation's been talked about in the last few days. It got me reflecting firstly on DIY injectables. That's something I've seen a lot online. I've even had patients come to me. I remember one in particular. I was working for a clinic and a new patient came in and they were telling me how they bought a under eye filler, which turns out was not an under eye filler, online, injected it themselves in their home to their under eye area, and had to have, it was either 2 or 3 surgical procedures to remove that product, which the surgeon described to them as the product being like concrete. There's the Hyaluronic pen that's been floating around for quite a few years, where non-medical professionals will inject a dermal filler type substance they call it a non-needle way via this device, which can lead to really bad adverse outcomes. You've got, as I mentioned, non-medical professionals posing as nurses or doctors and injecting products into the face or other body areas. There's one in particular that I saw circulating in the last few days where they continued to practice even after a public HCCC report was made about them. And just my day-to-day conversations with my patients, there's an alarming amount of people that during that consultation, they'll tell me that that is the first time that they're ever hearing the risk factors and they've had multiple treatments before, that they didn't have any understanding of the products or dosing that they'd previously received, that it was their first time that they've ever signed a consent form or spoken with a medical doctor via telehealth or had any formal post-care or follow-up documentation. So what should we be looking for when getting a cosmetic procedure? You need to be making sure that person is a registered nurse, doctor, or a dentist. Now you can double check their registration with AHPRA. You can go to their website, you can type in their name, that will bring up their actual qualifications and if they have any reports about them and their practice that have been made previously. When looking at the cosmetic clinic, consider the environment. Is it a clean, clinical, professional environment? Avoid visiting someone's living room or their garage. And if you want to go this far, you can also check if that clinic space is registered with the local council. Information on products, pricing, and dosing and the treatment process should all be explained to you during your consultation. Then if you are proceeding with a treatment, you will sign a consent form, and if you're visiting a registered nurse, you will also speak with a medical doctor either in person or via telehealth, and you will also receive written post-care information. Make sure you ask questions about the treatment and the experience of the injector as well. Now, if you visit a practitioner who ticks all of these boxes, complications, even minor, will be extremely rare and never a hospital admission post a wrinkle reduction treatment. I'll finish with this, and it will hopefully be some thought-provoking questions. One is for consumers. Have you done your research on your injector and the clinic, and have you asked the questions that you should be asking, and do you feel safe in that environment with that person having that treatment? 2, for cosmetic injectors, do we feel that the regulation changes have increased dodgy behavior in the industry and have made it actually less safe for our consumers? Thank you so much for tuning into this bonus solo episode. You can find us on YouTube, Spotify, and Apple. Bye.